Hello, my name is Hendrik Mehrtens and I'm from the German Cancer Research Center, and today I will present to you our paper Pitfalls of Conformal Predictions for Medical Image Classification. Over the last few years, multiple approaches for uncertainty quantification have been proposed. Currently, the framework of conformal predictions, which is a post-hoc calibration method, has gained a lot of attention due to its ability to guarantee a set level of true label coverage. However, conformal predictions, like any other method, comes with caveats, pitfalls, and potential misunderstandings practitioners must be aware of. In this paper, we discuss and show pitfalls of conformal predictions in medical image classification, with the intended audience being practitioners who want to utilize it for their research or applications. The core assumption of conformal predictions is exchangeability of the calibration and test set. Instead of producing scalar uncertainty values, like for example the confidence value of a neural network prediction, conformal predictions produces minimal prediction sets which can be seen as analogous to confidence intervals in the regression setting. The main motivation for conformal predictions is that it guarantees that a true label is in at least a specified proportion of all predictive sets over the test distribution. As the coverage guarantee of conformal predictions only holds over the whole distribution, it does not hold in general for structured subsets of the data which might follow a different distribution. This has large practical implications, for example for the fair treatment of population groups or the resulting unequal coverage of individual classes. For example, on the right-hand side, for the HAM10K dataset, the melanoma class, which is depicted in green, is largely undercovered compared to benign classes like nevi, which is highly undesirable and dangerous. This is a general problem of calibration methods, and practitioners must be aware of this problem and not be held in a false sense of confidence due to the guarantees provided by conformal predictions. Furthermore, while medical classification problems containing multiple classes are common, many problems can still be seen as binary-like tasks, where the classes can be split into the two superclasses, benign and malignant. Conformal predictions is often not applicable in tasks with a low number of classes, as the granularity in the resolution of the uncertainty estimate is limited by the number of predictive sets. As an example, even if you have a multi-class problem like HAM10K, predictive sets containing benign and malignant conditions, for example nevi and melanoma, might be uninformative to your application. On the right-hand side, you can see the growing proportion of uninformative predictive sets with rising coverage levels. However, just discarding the uninformative predictive sets might violate the guarantees of conformal predictions, as you are leaving out a structured subset of the data. Therefore, an application that wants to utilize conformal predictions should be able to utilize all possible predictive sets, which can be hard in practice. Which brings us to our next point. Rejecting uncertain predictions is one of the key goals of uncertainty estimation, with the goal of increasing the safety of the application. However, while we have found multiple publications that use conformal predictions for selective classification, we believe that conformal predictions are not the optimal tool for the job, as before, only utilizing the sets of size 1 cannot guarantee the desired coverage level, as it is again a subset of the whole test distribution. However, getting these guarantees is often the core motivation to utilize conformal predictions in the first place, and therefore other approaches can be chosen. We demonstrate this behavior on the right-hand side, where different predictive set sizes come to drastically different coverage levels. Of course, we could only cover a portion of the paper. For a more in-depth discussion of potential pitfalls and other pitfalls like domain shifts, and a discussion of the applicability and practical value of conformal predictions for medical image classification, please have a look at our paper.